Hello, everyone. I'm Dr. Hiroshi Takeda, and today I want to address a topic that may seem minor at first but can have significant consequences if neglected: cutting your toenails too short. While it may appear like a simple grooming habit, trimming your toenails improperly can lead to severe discomfort, infections, and even complications that affect your mobility and overall health. In my years of practice, I have observed that something as routine as nail care can impact quality of life, particularly in older adults or individuals with underlying health conditions. The reality is, nails are more than just cosmetic features. They are integral to protecting the toes, providing structural support, and even influencing balance. Today, we'll explore why cutting toenails too short can be harmful, the types of complications that can arise, how to prevent them, and the most effective ways to maintain healthy nails. By the end of this video, you'll have practical, evidence-based guidance that will help you keep your feet healthy, comfortable, and free from preventable problems. Let's begin by understanding the anatomy of the toenail and its role in overall foot health. The nail plate, the visible hard portion of the nail, sits atop the nail bed, which is a delicate layer of skin rich in blood vessels. Beneath the base of the nail lies the nail matrix, the area responsible for producing new nail cells. Nails grow slowly but continuously, with toenails averaging around 1 millimeter per month, a growth rate that further slows with age. This slow growth means that any trauma to the nail, including cutting it too short, can have prolonged effects and may take months to resolve. In older adults, nail growth is even slower, and the nails can become thicker, more brittle, or irregularly shaped due to changes in circulation, collagen composition, and overall cellular function. When a nail is cut too short, the surrounding skin can be exposed to pressure from shoes, friction, and minor injuries, making it highly susceptible to infection and pain. One of the most common problems resulting from cutting toenails too short is onychocryptosis, commonly known as an ingrown toenail. In onychocryptosis, the edge of the nail grows into the surrounding skin, causing intense pain, swelling, redness, and sometimes discharge. This condition can be triggered by trauma, constrictive footwear, improper cutting techniques, or even subtle changes in foot shape caused by obesity, edema, or deformities such as hallux valgus or hammer toes. Older adults with comorbidities such as diabetes mellitus, peripheral neuropathy, or peripheral artery disease may not initially notice the pain, allowing the infection to progress unchecked, which can result in severe complications like osteomyelitis or gangrene. Preventing ingrown toenails begins with proper nail trimming. The nail should be cut straight across with the corners slightly extended beyond the distal edge of the lateral nail folds, rather than rounded or excessively shortened. If an ingrown toenail does occur, conservative treatments such as taping, cotton packing, dental flossing, or nail bracing can be attempted. In persistent or severe cases, surgical interventions including partial or complete nail avulsion with or without matrixectomy may be necessary. Evidence shows that both non-surgical and surgical interventions yield high patient satisfaction, provided the nail is properly cared for afterward. Cutting nails too short can also cause trauma to the nail bed, resulting in subungual hematomas. These are collections of blood beneath the nail plate, usually presenting as dark purple or black discoloration. Subungual hematomas are painful and may cause the nail to lift or even separate from the nail bed. In mild cases, the nail may heal over time, but in more extensive cases, medical intervention such as trephination or partial removal of the nail may be required to relieve pressure and prevent further complications. Another related concern is retronychia, a condition in which the nail plate grows backward into the proximal nail fold, often as a result of repeated trauma or a single incident of nail injury. Retronychia can cause overlapping layers of nails, inflammation, paronychia, and chronic discomfort, Treatment may involve surgical removal of the nail, but early detection and proper foot care can prevent severe outcomes. Beyond mechanical trauma, cutting nails too short increases susceptibility to infections. Bacterial infections, such as acute paronychia caused primarily by Staphylococcus aureus, can develop when the protective barrier of the nail is compromised. Symptoms include erythema, tenderness, swelling, and pus formation around the nail fold. Treatment typically involves incision and drainage, warm saline soaks, and antibiotics tailored to the infection's sensitivity. Fungal infections, such as onychomycosis, are another concern, particularly in older adults or immunocompromised individuals. Onychomycosis affects the nail plate, causing thickening, yellow discoloration, crumbling, onycholysis, and subungual hyperkeratosis. Poor nail trimming practices can exacerbate fungal colonization by creating microtraumas or exposing the nail bed. Accurate diagnosis often requires nail clippings for mycological testing, as fungal infections can mimic trauma-related nail dystrophy. Effective treatment may include topical agents like cyclopyrox or efinaconazole, systemic therapies such as terbinafine or itraconazole, and proper foot hygiene. However, systemic therapy must be approached cautiously in older adults due to potential drug-drug interactions and comorbidities. Another critical aspect of cutting nails too short is the development of onychias, or localized nail plate hypertrophy. This condition results from trauma, improper footwear, overlapping toes, or other mechanical factors, and leads to thickened, discolored nails that can cause pain, friction, and an increased risk of secondary infections. Management includes trimming nails carefully, filing to reduce thickness, and, in severe cases, chemical or surgical nail avulsion. Preventative measures, such as wearing well-fitting shoes and avoiding excessive pressure on the toes, are essential to maintain nail health. It is also important to consider the physiologic changes of aging nails. Older adults often experience slower nail growth, increased nail thickness or brittleness, longitudinal ridging, and color changes. These changes make nails more prone to splitting, cracking, and infection, particularly if they are cut too short. For example, brittle nail syndrome is characterized by onychoschitzia and onychorexis, where the nail layers split or become fragile due to decreased intercellular adhesion and impaired nail matrix function. Repeated trauma from aggressive trimming can worsen these conditions, making simple preventative care vital. Treatment focuses on avoiding excessive water exposure, minimizing trauma, wearing protective gloves during wet work, and applying nail strengtheners. Footwear plays a significant role in preventing complications from short nails. Shoes that are too tight or narrow in the toe box can exert pressure on the nails, exacerbating pain and promoting ingrowth. In addition, individuals with deformities like hallux valgus or rotated toes are more susceptible to mechanical nail trauma. Comfortable, properly fitting shoes with adequate room for the toes are not just a matter of comfort. They are a medical necessity for preventing nail complications. For patients with chronic health conditions, extra caution is necessary. Diabetes, peripheral artery disease, and peripheral neuropathy reduce sensation and circulation in the feet, increasing the risk of unnoticed injuries, infections, and delayed healing. In such populations, even minor trauma from cutting nails too short can escalate to severe infections, sometimes requiring hospitalization or surgical intervention. Regular foot examinations, both by the patient and healthcare providers, are critical to detect early signs of complications. Now, let's discuss proper nail cutting techniques to maintain healthy toenails. First, always use clean, sharp nail clippers designed for toenails. Soaking the feet in warm water for a few minutes softens the nails, making cutting easier and reducing the risk of splitting. Trim nails straight across, leaving a small margin beyond the corners of the nail fold. Avoid cutting nails too close to the skin or rounding the corners excessively, as this increases the risk of ingrown nails. After trimming, gently smooth sharp edges with a nail file to prevent snagging or tearing. Maintaining regular trimming intervals, about once every 6 to 8 weeks, depending on nail growth, helps prevent the nails from becoming excessively long, thick, or prone to trauma. Education and awareness are critical components of prevention. Many patients, especially older adults, may be unaware of the consequences of cutting nails too short or may struggle with mobility and dexterity that makes proper nail care challenging. In such cases, professional assistance from podiatrists or healthcare providers may be necessary. Podiatric care can include safe trimming, debridement of thickened nails, treatment of fungal infections, and guidance on footwear to minimize mechanical stress on the nails. For older adults living independently or in care facilities, regular foot care assessments are essential to prevent complications and maintain quality of life. In addition to mechanical and infectious issues, improperly cut nails can contribute to pain and functional limitations. Painful toenails can deter walking, reduce balance, and increase the risk of falls, particularly in older adults. Even mild discomfort can alter gait patterns, leading to secondary musculoskeletal issues such as knee, hip, or lower back strain. By maintaining proper nail length and preventing complications, patients can preserve mobility, reduce pain, and improve overall quality of life. It is also worth noting that psychological and social aspects are affected. Discolored, thick, or painful nails can cause embarrassment, reduce confidence in social interactions, and discourage activities such as swimming or wearing open-toed shoes. Nail care, therefore, is not merely a cosmetic concern, but an integral part of holistic health and well-being. Regular, safe nail care empowers patients to maintain not only physical health, but also emotional and social wellness. When complications do occur despite preventive measures, early intervention is key. Acute paronychia, onychocryptosis, subungual hematomas, and fungal infections respond best when identified early. Conservative measures like topical treatments, warm soaks, or protective padding can prevent escalation. Surgical interventions, when necessary, should be performed by qualified professionals with attention to minimizing tissue damage and preserving nail function. Delayed care can result in chronic pain, secondary infections, or even the need for more invasive procedures. Education should also include guidance on warning signs that warrant medical attention. Redness, swelling, persistent pain, pus, or bleeding around the nails are indicators of infection. Discoloration or separation of the nail plate, especially when accompanied by pain or odor, may signal fungal infection or subungual hematoma. Early consultation with a healthcare provider ensures appropriate diagnosis and timely treatment, preventing complications that could otherwise compromise mobility and quality of life. Preventive care also extends beyond trimming techniques. Maintaining good hygiene, keeping the feet dry, wearing moisture-wicking socks, and alternating footwear to allow ventilation can reduce fungal growth and bacterial colonization. Avoiding self-treatment with sharp objects or chemical irritants is essential, as these practices can worsen trauma and increase infection risk. For patients with comorbidities, coordinating foot care with healthcare providers ensures that treatments do not interfere with medications or exacerbate underlying conditions. In summary, cutting toenails too short may seem like a minor grooming mistake, but it has far-reaching consequences that can affect physical comfort, mobility, infection risk, and even psychosocial well-being. Understanding nail anatomy, physiologic changes, risk factors, and preventive strategies empowers individuals to protect their foot health. Regular, careful trimming, proper footwear, awareness of warning signs, and professional guidance when necessary create a comprehensive approach to maintaining healthy nails. By taking these measures, patients can prevent pain, infections, and complications that may otherwise disrupt daily life. Thank you for watching and for taking the time to learn how something as simple as proper toenail care can have a profound impact on overall health. I encourage you to share your experiences, ask questions, and engage with your healthcare providers about your foot care routine. Healthy feet are the foundation of mobility, independence, and quality of life. If you found this information valuable, please like, comment, and subscribe to stay informed about essential health topics. Remember, small preventive steps today can prevent significant health issues tomorrow. Your feet and your future will thank you.